All right, a trip to the ER does not sound like a happy holiday, but emergency rooms and doctors, they always sometimes seem to see an increase this time of year. And one reason, family members, maybe you haven't seen one in a long time and they show up and they might have an issue you don't know about. So Dr. Arbaje is here to tell us how to avoid holiday surprises and not the good kind.
Exactly right.
What does this mean?
This is a really tough time of year because people are traveling, and the people who normally take care of older adults tend to go on vacation, and there's new people coming to see them. And then also older adults are traveling, they're being exposed to more people, different kinds of foods, and all sorts of things can happen, especially when you haven't been seeing your older adult loved one in a long time. So this is an important time of year to think about these issues.
Because this can lead to a problem.
Very much so. For the most part, if you haven't seen your loved one in a while and then you see them and you think that they don't look very well, it could just be that they have many problems that you didn't know about and that they're actually being managed just fine. So you don't want to try to take them to the emergency room or to the hospital if they already have a problem that's already under control. That's why it's good to stay informed.
But how do you do that without getting nosy and maybe offending them?
Right. Well, that's an important point. But there are a few things that you want to really think about. It's important to stay informed, to stay in contact with your loved one throughout the year. One way to do that is just to really check in on them. How are you doing? How's the family? But also, have you been making your doctor's appointments? Are you taking your medicines? Are you having any issues with them? Any help that you need? Those kinds of things. Because the number one surprise that people have when they see their loved one when they come is that they just look more frail. They look like they've lost weight, or they've lost some height. Maybe they're not eating right, or maybe their grooming isn't quite as good. Their teeth don't look quite right. So these are all signs that something might be going on, and it's important to keep track of that throughout the year.
A better thing to do throughout the year, and maybe even contact people that might see them on a regular basis.
Exactly. So here's one of the problems, that older adults have many healthcare problems, many healthcare conditions, many healthcare providers, many medicines. It's really hard to keep track of it if you're just seeing them once or twice a year. And also, older adults' health can change on a dime. So one week they could be fine, and then 2 or 3 weeks later they might have a whole new problem that can land them in the hospital. So it's really hard to keep track of these things if you're not staying in the loop throughout the year.
I would also think, too, it's got to be not the best thing for an elderly relative to go to a strange doctor or a strange environment with that long health history.
This is a very good point. This is why two things are important. One, the person that they're visiting needs to have as much of a record as they can on what that person already has. So in case they do have to go to the hospital, they have that information. But it's also important to remember that holidays are times of low staffing in many places, and that includes hospitals and doctors' offices. So the information that's usually available isn't always there.
Is there anything that caregivers need to be doing this time of year?
Yeah, so besides checking in with their loved one to make sure that everything is going okay, they should maintain a list of that person's healthcare conditions, their medications, and all the doctors or healthcare providers that they see. And then also, that loved one should have programmed into their phone or some other easy way, a way to reach their doctor and their healthcare providers if there's any problems. So in the phone, you can program emergency contact, healthcare agent, primary care doctor, so that it's easy to reach people if there is an emergency.
Your Aunt Mimi comes to visit. Is there one thing that you should know that maybe should tip you off to maybe something's not right?
Right. So some things any problems with grooming or with hygiene are very important. If you notice that the person's just fatiguing more easily, we heard a little bit about holiday fatigue earlier. If they're just not fatiguing a little more easily, if they're not getting around as easily as they should be, if they're starting to have problems with their memory and asking you repeated questions, those are some of the signs. And a big sign is if you see any bruises, because that could mean that they're falling.
Okay, and that's a big one.
That's a big one as well.
Well, we love having you come in. You're always very helpful with your advice. Good to see you.
Thanks for having me.
And happy holidays.
You too.
No surprises, right?
No surprises, let's hope.
Okay.